does Ottawa have an overdose action plan?
Depending on what you refer to as an action plan, yes, Ottawa Public Health does have an action plan. We've got an overdose, not an overdose, but a task force that's already set up, made up with our partners, to talk about and to think about the issue with opioids. And let's make that a little bit more clearer. The opioid is the issue here, and it is an issue for us, and it's an issue that we've been working with. We, BDO Ottawa Public Health, working with our partners like the schools in terms of education, as well as other partners that have come to us and said, we need help, and we're providing that help.
And how do you feel that this drug problem should be resolved? What do you think we should do to help prevent this from continuing? Of course, drugs have always been around and they will probably forever be around, but how do we limit overdoses and also limit teens using drugs?
Well, I'm not a medical professional, so I can only offer you opinions as to what I see. I think the Ottawa Public Health, working with their agencies and their partners, we're already doing that. We're trying to offer that help to the public, whether it's public from, doesn't matter what part of the city that they're coming from, that help is available to them. Like I said to you before, we're educating, people at one of the meetings in Canada had suggested that there wasn't enough education out there. So we work with our school partners. We're doing that now. We've been doing it all along. It's just now we're enforcing it even further.
And you mentioned about, advancement in schools. Do you think that could potentially help?
I think anytime you educate people, it helps. And sometimes it takes more of a focused education rather than just, putting out a flyer for that matter. And that's what we're at right now. We're doing face-to-face education with our partners into the schools. And I don't know whether you were present at any of the school presentation, but that's exactly what, between the school board, the other community partners, as well as Ottawa Public Health, we're bringing the forces together in order to educate the public.
So what you're hoping basically for is that this continues, and you feel that we'll get positive responses from doing that?
I think it has already received some positive responses. Parents appreciate that concept. And not only is it our mandate to educate the young people, but definitely also the parents. And I think the parents have a key role in this, to make sure that the messaging that they're receiving, that they're taking home with them and educating the young people directly.
And do you know if the city provides free naloxone to community providers?
Community providers, and again, that is one of the questions that I don't know. But I can tell you that when you talk about community providers, it's not like saying, here's naloxone, use it. You need to train. And all of that piece also plays into a role. The other thing is people mention about community centers and so on and so forth. It's not like a defibrillator case that you can put in there and let anybody use it. This is a very special skill that you need to have in order to provide the naloxone properly to the individual that may need it.
And do you know if police officers carry it with them?
As far as my understanding, yes, they do.
And what about firefighters? It was something that they did not carry around, and there's been a lot of talks about them carrying it around as well. Do you know if there's been any advancement as far as that goes?
Nothing that I can am aware of that the advancement has been made in the last, let's say 2 or 3 or 4 days. But I do know when the mayor went to Toronto and had a meeting with the premier of this province, they did promise her some money in order to provide some of those kits through our emergency services.
And do you think that would help as well, having naloxone available to other emergency services to help save someone's life?
Anytime you can provide a service is great, but providing a service without the knowledge, I don't think that would be the best thing to do. I think anybody that you provide the naloxone kits, including myself, where I have gone in to a pharmacy and picked up a kit from my office in the ward, for the purpose that, hey, if somebody does need it, the product is there. But I was officially could not walk out of a pharmacy without some kind of training from them. Although I've had previous training, but that's just one example. So, in terms of paramedics, all the paramedics carry it for obvious reason. They're medical personnel, and they know how to use it and how to implement the drug.
And do you know if the Board of Health is considering talking to people who have been impacted by overdoses to see what resources are needed to help them cope, and essentially just consulting the public?
And again, it's one of those questions that I cannot sit here and answer for you. The issue though is the public health is always talking to its partners. So if it's not Ottawa Public Health personnel reaching out directly, it's one of our partners that have had those conversations with the public.
And what do you think about expanding access to Suboxone in emergency offices and doctors? Do you think that could potentially help people stay off the drugs?
I don't know if they're not available already in the emergency departments. I'm pretty sure they're available in all of the hospitals, and I'm pretty sure even in places like Dr. Eugene Valier's office in Vanier, that Suboxone is available. It's available in Sandy Hill Treatment Center, so the product is out there, yes.
And is there anything you want to add on the overall, on the opioid crisis that is currently happening in Ottawa and in Canada?
I don't know whether I would go as far as, using the terminology that you're using. To me, there is an issue. It's an emerging issue. It is an issue that is changing with the kind of drugs that are out there, and those are changing on a weekly basis or bi-weekly or monthly basis. So we have to be very careful how we identify the issue. In terms of the issue itself, yes, there is. We're aware of it. The city is aware of it. Public health is aware of it, and we're working towards, looking at and working with the issue. We can't say we're going to solve it overnight. As you mentioned in your pre-comments, that the issue of drug use has been there for a number of years, or even more than a number of years, and it's going to probably take that much more time to do that. The other thing is we have to identify it seriously as to where the issue really is.